Do you frequently feel like your heart aches sometimes? Or maybe you've had a fever that just won't go away after a few days, along with strong headaches and pain behind your eyes. What if I told you these could be warning signs, not just from the flu, but from something more serious that spreads through a simple mosquito bite? That's dengue fever. Imagine getting bitten by a small, quiet mosquito during the day. Maybe you didn't even notice, but a few days later, you feel completely wiped out. That's how dengue starts. It's common in tropical places, especially where it's hot and rainy. Many people suffer every year, but the good news, we can prevent it and understand it better. So, have you ever had a fever that felt different? Let's talk about why that might be dengue. What actually causes dengue? Think about this. Have you seen those small mosquitoes that bite more during the daytime, especially around your ankles or arms? The ones that don't buzz loudly, but leave itchy bites. Yes, those could be Aedes mosquitoes, the main carriers of dengue. They carry a virus, not bacteria, called the dengue virus. There are 4 types, yes, 4. So even if you had dengue once, you could still get it again from another type. And here's a twist. Sometimes getting it a second time can be more dangerous. These mosquitoes love clean, standing water, like in flower pots, old tires, or uncovered water drums. So, did you leave a bucket outside after rain? That tiny puddle could be a nursery for hundreds of dengue mosquitoes. Now, let's play a quick game. Raise your hand if you've had a sudden high fever, like 104 degrees Fahrenheit, that came out of nowhere. How about severe pain behind your eyes? Or joint and muscle pain, so bad people call dengue breakbone fever. That's because it feels like your bones are breaking. Other signs include rash, nausea, vomiting, and mild bleeding, like nosebleeds or gums bleeding while brushing. But here's the scary part. In dengue hemorrhagic fever, things get worse. You might feel okay for a few days, then suddenly get confused, feel very weak, or vomit repeatedly. That's a red flag. That's when blood vessels start leaking, and it can turn serious very fast. So, if you or someone you know has these signs a few days after fever drops, seek help immediately. How do doctors know it's dengue and not just flu? Good question. If you go to the clinic saying, "I've had fever, pain, and a rash for 3 days," the doctor might order a blood test. 2 common ones are NS1 antigen test, which checks for the virus early, and IgM antibody test, which shows if your body is fighting the virus. Platelet count is also checked. Low platelets mean higher bleeding risk. Now, here's the truth. There's no specific medicine to kill the dengue virus. So treatment: rest, drink lots of water, oral rehydration, and take paracetamol for fever. Never take ibuprofen or aspirin. They can cause bleeding. In bad cases, hospital care with IV fluids may be needed. So if someone says, "Just take any painkiller, stop," that advice could be dangerous. Can we stop dengue before it starts? Yes, and it starts with you. Remember that old tire in your backyard? Or the water in your plant saucers? Let's turn those into no-go zones for mosquitoes. Simple tips: cover water tanks, clean gutters weekly, use mosquito repellent, especially during mornings and late afternoons, wear long sleeves, and use mosquito nets. In schools or communities, cleanup drives help a lot. And guess what? Some places use fish that eat mosquito larvae in ponds. Also, vaccines are now available in some countries, like Dengue, but they're only for those who have had dengue before. So ask your doctor. Want to help organize a tip and toss day in your neighborhood? Tip out water, toss waste. Boom, you just saved someone from dengue. Are scientists working on better ways to stop dengue? Absolutely. Imagine releasing good mosquitoes into the wild that can't spread dengue. Sounds like sci-fi. It's real. Projects like the World Mosquito Program use mosquitoes infected with bacteria called Wolbachia. These mosquitoes pass the bacteria to their babies, and it blocks the dengue virus from growing inside them. Field tests in countries like Indonesia and Brazil showed big drops in dengue cases. Also, new vaccines are being tested, like TAK-003, which works even for people who never had dengue. Some apps even track outbreaks using real-time data. So in the near future, your phone might warn you, high dengue risk in your area, wear repellent. Exciting, right? The fight against dengue is getting smarter every day.